All right, good afternoon, everyone. Thank you for joining us on this Wednesday, July 15th. We are in our fourth month of these weekly Wednesday media briefings. They are COVID-19 related, and as always, as of late, we have County Executive Marc Elrich, Dr. Travis Scales, our County Health Officer, and Dr. Ulf Stoddard, who is our Director of the Office of Emergency Management and Homeland Security. We're going to kick it off with the County Executive with a few remarks, and then take it from there. Go ahead, Mr. County Executive.
Hi, good afternoon to everybody who's joining us. A few things I want to talk about. First is the county has surpassed the state targeted rate of 10% of our population. We're into the 11% range now, moving to 12. We continue to increase our testing. We didn't set the state target as our target. Our target is to test as many people as we can possibly test. So we've met the state's metric, but we're continuing our testing. We are looking at what we can do to expand testing into the communities. I had a meeting with Latino communities leaders. I'll be meeting with African American community leaders to talk about what we can do to bring testing deeper into the community. But Dr. Gales will talk about the numbers. You get an idea about proportionality and what the test numbers actually really mean. We've done, I think it's over 145,000 tests so far. And that's total tests. That includes some people who've been tested twice. We are in the 118 range, I think, for testing in general, for unique individuals. So that's where we are in the testing. We're experiencing the same issues, though, everybody else is experiencing. This is a national problem. It stems from underlying social inequities. The fact that we have these test results doesn't change the fact that people are getting sick for a reason. These are often cases, particularly in the minority communities, they are the so-called essential workers. I say so-called because they don't get paid like they're essential. They just go to work and you decide they don't have to, they should not stay home. But they're the people who are the most exposed, and they bear the greatest risk in this. So we're aware of that, and we're continuing to work on that. We discussed today that we are going to go to construction sites where we continue to see workers not working with masks or wearing masks around their neck, which is kind of useless. They maybe technically have the mask on, but it's not doing them any good. And we will be giving warnings, and then we'll be doing what we're doing with other business. We're going to shut down sites where people work unsafely, because these folks, if they're exposed to coronavirus, they're bringing it back to their communities. They often live in the more crowded housing in the county. So anything that comes back into those communities is more likely to have community transmission. So we're going to double down on that work. We're on the stage now of on-demand testing. So when you look at test results and you look at positivity rates for the months of March, April, May, and part of June, you're looking at results that came from the instructions that the only people who could be tested are people who doctors determined to be symptomatic. And so your pool was already starting with people who had symptoms. And so it's not surprising that you have higher results of positivity in that group. But as we've tested a broader population, and now that we're able to test anybody and you don't need a doctor's referral, we're going to see, and we are seeing, changes in the positivity rates because the universe of who's getting tested has finally been enlarged. Our average test positivity is below the state average, and it's lower than several of the other large jurisdictions in Maryland. And I'll just say what I tried to say before, we can't test our way out of health disparities. This tells us what the health disparities are. It does not provide a solution. People would still be getting sick, no matter how much testing we're doing, until we can deal with the transmission of the virus, where people get exposed and how exposed people are able to pass the exposure on to other people. But I continue to work with our health department, and our health department continues to work with the state health department to provide guidance on what we should be doing in the county. And we're going to continue to do that. We're going to improve the things we can improve, which means the deeper testing in the community. But we're also going to look at what else we can do in the long run in terms of how do you deal with disparities. And hopefully the state will partner with us, because this is going to require a deep look at what we do for healthcare and what we do for housing, not just in the county, but in the state and certainly in the nation. We continue our support to individuals. I've continued to lobby the state on additional support, particularly on rents, and not necessarily directly to tenants, but certainly to use the landlords as a vehicle, because if the landlords get money to make up for lost rents, it's reasonable to ask them to forgive the tenants who haven't been able to pay the rents. And we know that it's a big lift to try to get the state, or at least the governor, to envision giving money directly to people who aren't documented. But I'm sure he would be concerned about landlords who, because they're not collecting rents, may wind up in default of their mortgages. So we're trying to come up with a solution to this problem. I submitted some budget changes. We took all the low-hanging fruit we could. We didn't cut programs. We focused on programs that we knew we weren't going to be able to operate. So even HHS got some cuts, but the cuts were not part of a decision to reduce programming in HHS. We were looking at what HHS is not going to be able to actually do that they otherwise would have done, and use that to provide the savings for this first tranche. We are waiting to see what the federal government does. There's more talk on the Hill about something coming out of the Hill before the end of the month. And when we know what that number is going to be, then we'll have a better idea of what deeper cuts we may or may not have to make. And I'll leave it there.
Okay, before we head over to Dr. Gales for a few comments, I just wanted to let everyone know that a 24-hour flash survey on mask usage in Montgomery County launched this morning on our social media platforms. As of noon, we have more than 800 responses to this. Clearly, people have a lot to say about it. You can look to Montgomery County's Twitter page at the top. It's pinned there at Montgomery COMD. Also on our Facebook page, as well as on Nextdoor. Dr. Gale.
Julie, can I add to that real quickly?
Sure.
So I think most of you know the governor sent out an edict encouraging the local jurisdictions to enforce his law. Well, we were already doing that. But we want to remind people that we are doing this, and we are asking residents, if you're in a place and you see people crowded at a bar, if you see people not wearing masks who are providing service, or customers not wearing masks, or conditions that we're not supposed to have. Last week, I think on one day, we had 70 people send us photographs. We will investigate. We will advise on what the right procedures are, and then we'll revisit to make sure the procedures are being followed. We are not going to go the way of these other states where reopening has led to a reemergence of the virus. We can only do this if everybody cooperates.
Thank you. Dr. Gales, go ahead.
Good afternoon. I'll keep my comments brief to leave time for questions. A couple of highlights to point out that the county executive mentioned is overall, in terms of our demographic numbers that we're looking at in our dashboard, we have surpassed 11% of our population tested. We've tested, as of this morning, 11.3% of our population. The test positivity rate for our county continues to come down. In fact, even today, with a report of 103 cases, those 103 cases were out of 3,973 tests. And so that comes to a test positivity of 2.6%, and is evident of the increased testing that we're seeing across the county, as evidenced by the increased testing in our healthcare centers, but also in the increased testing opportunities that we have expanded in the county, including expanding access to our current standing sites, the pop-up sites that we have in place. For example, we had a pop-up event at Silver Spring Civic Center yesterday that tested over 700 individuals, and in combination with our test site that's regularly open at the White Oak Station, just by the county programs testing yesterday, we tested over 1,000 people, which was a record for our services. Now, again, we don't celebrate that. We want to continue to expand, and based upon the data that we've looked at across the board in our zip codes, codes. The top 10 zip codes where we've seen the most cases, we've also seen the most tests. 9 out of those 10 zip codes have tested over 10%, or 10% of their over 10% of their population have been tested to date today. And as time has moved forward, we have seen the percent of residents tested increase. We've seen the number of tests offered and taken increased. We've seen test positivity rates for all geographic areas as well as racial and ethnic groups decrease over time as well. I know that there was a story that talked about the increased percentage of cases within the Latino community in the county that came out yesterday or today. I do want to highlight that it's important to note for the data that we have that does show racial and ethnic categories for testing data, we actually see the highest number of tests in the county overall, as well as those top 10 zip codes that we've mentioned before. The highest number of tests have been in the Latino community. And in addition to all the other categories, we have seen improvements in terms of the number of cases on a daily basis. If you think back to June, we were seeing averages of 300 a day. Now we're at the point where it's anywhere between our 3-day averages are somewhere between 50 and 75. So that shows significant progress across the board. Now we do recognize, though, as the county executive mentioned, we still obviously have cases and we have plateaued in a sense. We've been hanging out at that average for a while now. We want to see continued improvement before we talk about moving to other phases of reopening. And so what we have been working internally is to try to figure out what are those factors continuing to drive those as we continue to ramp up testing. We know that that's important, but what are the factors that are predisposing people to getting COVID-19, and how do we set up policies and have discussions to remove those particular factors? So we continue to push, as the county executive mentioned, conversations to talk about how we create policies that create effective change to remove those systemic factors that are predisposing folks to getting COVID more frequently, as well as having worse outcomes. Now, part of that, we recognize we certainly don't have all the answers. We have partnered with our colleagues in Prince George's County and the state to get assistance from the CDC. The CDC has sent a team here. They've been on site for over a week now to help us with that. And part of that strategy is being to help assist in pulling apart the numbers even more to get a better understanding, but also reaching out to the community and conducting objective research to find out what factors are motivating people to get tested or not get tested. What are the barriers in place, and how can we improve and enhance the message that we provide, as well as enhance the level of participation that the community has in terms of creating and furthering this outreach. We have more details to put out once we crunch the numbers even more, to highlight and show those test positivities by different groups, to demonstrate and confirm that we are moving in the right direction, even though we still have a lot of work to do.
We have not yet cloned Dr. Gales, and he's got to bounce at about 1 o'clock to be on another panel. So reporters, if you have a question specifically for Dr. Gales, please enter that into the chat, and we'll get to those questions first. Dr. Starter, did you want to kick off with any remarks before we go to questions?
Yeah, I'm just going to give a couple quick updates. We're expanding our personal protective equipment. Our Department of General Services and Procurement have made more than, we've actually made a purchase of almost $15 million of PPE over the last month to begin to make sure that, to continue our efforts to make sure that we're ready for the fall, spring, and beyond for personal protective equipment. We did do a child care distribution on Saturday. More than 600 child care providers received personal protective equipment, cleaning supplies, infrared thermometers, so they continue to operate for the next 4 weeks. We gave them a 4-week supply. Dr. Gales and I did a walkthrough with the Montgomery County Public Schools. Deputy Superintendent McKnight was there, as well as other members of the MCPS staff to walk through an in-school experience last Thursday. I think the obvious comments are that while we all agree that having in-school education is an important part of childhood development, we are not going to operate schools unless they're safe for both faculty, staff, and students. That's been clear. I know that Prince George's County announced they're keeping all online through the fall. And so we're going to be continuing to evaluate those circumstances with our partners in MCPS, and we'll make similar similar determinations as conditions warrant. Education enforcement, County Executive alluded to the letter from the governor. We're already doing the work of enforcement. I know we made announcements related to the closure of a few restaurants who are restaurants, operating sort of like bars over late at night, over the weekends. Our clear message is the overwhelming majority of businesses are doing exactly what we've asked them to do. In other cases, we've attempted to use education to get those who are close and making a good effort to be fully in compliance. And we only turn to enforcement in the limited circumstances where there's been a willful ignorance or willful ignoring of the public health guidance to really pack people into places that they shouldn't be in without face coverings and other things like that. So, and then finally, last night we had our Community Recovery Advisory Group kickoff meeting. We had 49 representatives from county residents across the county. Some really great discussion about what our work in recovery will entail and the challenges of doing recovery in the context of an ongoing response. All things that we're aware of, but certainly their perspective on how we can do things better is very important to us. We'll meet again on July 28th, and we'll continue to be with that group moving forward to give us a good perspective from a diverse representation across the county.
Thank you, Dr. Stoddard. We will kick it off with Caitlin from Bethesda Beat, who has a question for Dr. Gales, because as I mentioned, he has to go in about 15 minutes. So for the reporters, questions for Dr. Gales, please put those into the chat. Go ahead, Caitlin.
Hi, Dr. Gales. Yesterday at the Montgomery County Board of Ed meeting, you said that the county needs to make some more serious improvements in COVID-19 conditions before buildings could reopen. But I wasn't clear about your answer to a board member's question asking whether the county needs to move forward to the next phase, as we're calling it, for that to happen. Can you address that? And additionally, can you just explain if there are any specific metrics that you're hoping to see improvements in, just to give a clearer picture of where we need to go from here to get to that point?
Good afternoon, and thank you for your question. So the reason why I didn't necessarily say a phase is, again, making sure that we're consistent with the state and moving together. But what is clear that in order to be able to move forward, as Dr. Stoddard just mentioned, is that we are at a place where we have seen significant improvements in the load of the virus within our community. We're seeing less community transmission, and we are at a point where, because the reality is when we reopen things more and we increase contact points, whether we're talking about kids or adults, we want to make sure that we've driven the burden of the virus down to a much smaller number that alleviates or has a low probability or risk of it being transmitted from person to person within our communities. So the types of things that we're looking for is basically, again, what we would look for in terms of moving forward in our phases, a place where we are seeing minimal cases and minimal evidence of large-scale, widespread community transmission. We're seeing significant, even increased access to testing to be able to test quickly for anyone who is identified as a contact. And we're moving in all of those right directions. Right now, when we look at our daily case average, we've improved from 300 to 150 to now we're hanging out in the 50 and 60s, but we've plateaued a little bit. And so we've got some more work to do to drive that number down even more, so that we feel that we can safely open up those schools again. And some of the other things that we can't necessarily control that would be very helpful in that conversation is, if we do have a vaccine or we do have some other types of scientific advances that would, again, alleviate some of the probability and the higher risk of transmission if we were to open those types of venues back up.
Okay, Caitlin, Dr. Gales, thank you very much. Up next is Randy Bass with WDVM with a question about testing.
Good afternoon, everybody. Thanks for having me on the call. Question for Dr. Gales. I've noticed that when you're looking for a testing site in some of the more outlying areas of the county, say Damascus, Laytonsville, Poolsville, sometimes that nearest testing site is a 20-minute plus drive or somewhere outside of the county entirely. Can you touch on how the county might expand testing in the western and northern areas of the county?
Sure, that's an excellent question. So I want to emphasize that a point that I think it's important to remember. So testing can happen in places outside of the sites that we put forward as a county. You know, you can get tested at your primary care provider, urgent care facilities, and a host of other places. Now, we do recognize that for many locations, that still does present a travel obstacle. There still may be some distance within that. So we are working with some of those municipalities to set up pop-up testing events and exploring other options to be able to provide testing. For example, I believe there is a pop-up testing site that's going to be in Poolsville on, I think, July 18th. Let me check on my notes and confirm, but we do have one scheduled for Poolsville. And as I mentioned, we're also working with other municipalities, particularly in areas that, as you described, have a farther distance between those test sites and access to that, to make sure that they're more accessible.
Thank you, Dr. Gales. Tom Fitzgerald with Fox 5 is up next with a question for the county exec. Hold on, Tom, 1 second. Let's get you unmuted. There you go.
There we go. Thanks for doing the briefing, as always. County Executive, you alluded to it earlier, but I'm going to give you two right off the bat so we don't have to jump back and forth. The governor's letter yesterday raised some eyebrows with some folks because at one point he alluded to and wrote, you have a responsibility to enforce the laws. County Executive, are you enforcing the laws?
We're trying to. We're going out with our ambassadors. They're inspecting business sites. They're giving them guidance. We know this is new for everybody, so we figure everybody gets a one-time, okay, these are the things you need to fix. We'll be back. We want to see them fixed. But we've closed businesses down, and other businesses have just chosen to comply. And then one owner decided he wasn't going to open at all on his own, which I don't know why anybody would walk away from money over whether or not you wear a mask, but that's his decision, not mine. So we're enforcing, and we're going to do the same thing on the construction sites. I mean, these high-risk jobs tend to be the ones that are least monitored, and we're going to go in and monitor them and get these folks to comply as well. This is the only way we're going to get this done.
And just
the governor has an enforcement authority. He does have the state police. I mean, I'm a little bit surprised that it's not a joint effort, since he has resources he can put into enforcement, rather than saying, this is the state rule, and by the way, everybody go enforce it for me.
And just to follow up on that, we talked to the general manager yesterday of Tommy Joe's in Bethesda, and they've invested a lot in plexiglass shields around the bar. They were sanitizing the restaurant while we were there. They've been doing a lot of work to get whatever business they can. They're very concerned that the few bad apples are going to ruin this for everybody. So what can you say to the bar and restaurant owners about how the county is going to approach this? Is this going to be pinpointed enforcement, or is everybody going to wind up paying the cost for the few people that aren't following the rules?
Right. If I wanted to do pinpoint enforcement, if I wanted to do blanket enforcement, I'd just say, bad mistake, some people are breaking the rules, let's shut it down. We're not doing that. We are relying on the fact that most people would rather be open and would rather do it safely. And I can tell you, customers would rather be in a place that's safe. I've had people who told me about places they would not go into when they saw what was going on inside the door. So we're giving everybody a chance just to come into compliance. The owners do have to have the fortitude to tell somebody who's breaking the law that you have to get out. They have the authority to do that. They don't have to serve people who, violate the law. They should just say, you guys are breaking the law, and get out of here. But we're relying on the fact that I think most businesses in Montgomery County would rather be in business than shut down again. And this is a small price to pay.
Thank you.
Thank you, Tom. Brianna with Bethesda Beat has a question for Dr. Gales before he has to go at 1 o'clock. And then Jordan will come back to you.
Thank you so much. So I just wanted to clarify something about the benchmarks. I know that you have addressed that there has been an increase in testing. As far as the number of new confirmed cases that's on the data dashboard, I know it's down to 4 declining days out of 14. Are you attributing that that pullback and progress to the increase in testing, or do you think there might be an indication of a spread?
That's a great question. So one of the joys of sitting within and looking at lots of surveillance reports on a daily basis is we get data from a number of sources. And the way it's reported is different. So for example, if you look at the way that we report daily totals, we align it with the way the state reports theirs. And that is based upon all of the tests that were resulted positive today, regardless of when they may have entered in the system and been collected. Now, there is another, if you look at, for example, Baltimore City's testing website, they tie that to the REDCap system. And so the REDCap system is another database that we have access to that is kind of behind the scenes, where it reports cases based upon the day it was collected. And so it actually gives a sense of the actual daily case count. Now, conversely, you have DC that looks at it based upon the date of symptom onset. So there's different ways you can present the data. And I say all of that to say that one of the challenges with the way that it's presented by the state is that you can have data dump, so to speak. You could have reporting a lot of cases on one day that weren't necessarily collected at the same time. Now, so we look at everything within context. We look across all of those different things. And when we've looked at our REDCap data, we actually have seen our daily cases hanging out in when I keep throwing out the 50 to 70 range, that's more of an accurate depiction in terms of daily case count. So, for example, when I'm looking at my notes here, when I look at cases from July 5th, 38 cases. So it's reported differently, by the state data in terms of how many labs were resulted that day, but of actual tests drawn in Montgomery County for Montgomery County residents on July 5th, 38 of those tested positive. And so it's when we're looking at the data, that's why I mentioned that we've plateaued, because the numbers are consistently in that range. And it suggests that, some days there's an uptick, other days there's a little bit of a decrease, which suggests that, again, we have plateaued and we're hanging out in that space. Now, I will caution that we have seen an uptick in cases in other areas in Maryland. As evidence when you look at the state totals that are reported each day. And of note, the percentage of those cases has shifted from originally, and pretty much through the pandemic, the majority of those cases each day were coming from the National Capital Region. Data over the last couple of days suggests, however, that the majority of cases now are concentrated in the Baltimore metropolitan area and those counties and surrounding areas. So I think that's another thing of importance. Now, don't get me wrong. We watch these carefully like a hawk every day, and we're looking at different data sources, again, to get an accurate depiction of where we stand to determine if we need to, move forward or move back, and what additional steps we need to take to keep the residents of our county safe.
Dr. Gales, do you have time for a school reopening question, or do you need to go because it's one?
Sure. I'll take it. That's fine.
Okay.
Thank you all for your patience, and thank you, Mark and Earl, for allowing me to answer and step
To
off.
dominate. Chris Gordon, go ahead real quick.
You're on mute. You're on mute.
Can we get Chris?
You're still on mute.
No. Okay.
There we go.
Now?
We can hear you now.
Go ahead.
I will be brief. We just heard from Dr. Jack Smith, and he's basically saying that they're going to start with virtual learning, and hopefully in 8 weeks or so, somewhere around November, move into schools. You just acknowledged, I believe the county executive acknowledged that you've heard that Prince George's County just decided today and announced that they're going to stay closed with virtual learning through January. Is there any chance that Montgomery County will stay closed with virtual learning through January? How would you make the decision to open?
Well, first and foremost, let me say that our colleagues at MCPS have worked tirelessly to review all the data and come up with their plans. They've worked very closely with us and have been great colleagues, and very much driven by public health data, and will be continue to do that. I think part of the challenges is we'll have to wait and see how the data goes. Certainly, they recognize that reopening in person is likely not feasible and would hence their virtual plan. And I think they will continue to assess. From my understanding, DC has made a decision to be virtual until December 1st and will reassess there as well. So I think, it's one of those things we'll continue to see what the data shows and act quickly and decisively to provide that information when it's provided or when it's available. But right now, as Dr. Stoddard mentioned earlier, the data right now does not suggest that in-person instruction is safe to do at this moment. And again, as I laid out to the earlier question, we need to see improvements in the numbers to, again, see little to no infection in our communities to allow us to be able to feel comfortable opening schools up and that there's low risk in terms of putting people back in those environments.
Thank you for your time, Dr. Gales. We'll let you go. And now we'll go back to Jordan Lindsay, who has been waiting patiently with my MC Media. She's got a question for the county executive. Go ahead, Jordan.
Great. Thank you so much for your time. I truly appreciate this media briefing. Similar question as Chris Gordon, but to the county executive. MCPS just announced phases on how they're going to gradually do this virtual until they get to a point maybe students will go in person. But I just wanted to know how the county will respond to that. If you can elaborate a little bit more, County Executive Elrich, in regards to that. And how does that correlate with the county's phase reopenings as well?
So the school system exists in a slightly different world than us. And they're a state agency and they work with the State Board of Education, and whatever plans they do will be approved by the State Board of Education. And I imagine that health officers can alter a decision like that. That would be interesting at the state level to see the discussion between the school board and the state health officer. I think these things are going to get worked out at that level. And I expect that our health officer will contribute to the conversation in terms of trying to express his concerns about, if it's done and how it's done. But the county doesn't have I don't have any ability, from my position to veto or stop or alter something that the school system is going to do. So that's not something I will do more than opine on, and hope that they take everybody's opinion into consideration. I'm a former teacher. This is a big deal, and I know a lot of teachers are nervous about going back, and we need to have a better sense. I guess we'll know pretty soon what the board is going to land on.
I would also add, if I may, in our recovery framework, the education mission area has been one that we've spent a lot of time working with. I would say MCPS has been more collaborative on the issues around COVID than almost any other issue that I've experienced in my time in Montgomery County. We've shared with them information about our reporting for potential exposures, how we notify or how we close down county buildings if we have an exposure. All those things they've really tried to parallel in a lot of ways to what the county is doing. And so certainly, as the county executive alluded to, the executive branch doesn't have certain authorities to close them down. The state health officer, or the health officer does, in many cases via state law. But they've been more collaborative on this issue than any that I can recall. And obviously, we're working with them very closely. We understand the benefits of in-school education. We also understand the risks posed by doing it. And those two things must be considered, reasonably. And at this point, I don't see a safe mechanism to do in school right now. And so, barring an improvement in our numbers, I don't know that we'll see it in the fall.
Okay. On that note, Dr. Stoddard, Mr. County Executive, thank you for your time, and for all the reporters on the line, thanks so much for being here. We will see you next week on Wednesday, as always. Take care. Be safe.
Thank you all for coming and asking questions.